These are all the orthopedic tests for the lumbar region. We're going to do the ranges of motion first. We're going to do lumbar flexion, which is 25. Then we're going to do lumbar extension, which is 30. Then we're going to do lumbar lateral bending, so left lateral bending is 25. Right lateral bending is 25. And then we're going to do rotation. So left rotation would be 30, and right rotation would be 30. The next thing we would do would be bony palpation of the lumbar. You would start at the lumbar spinuses, palpate down the spinous processes until you get to the sacrum, and then you would palpate the sacral tubercles. And then you would go to the iliac crests, and then you would go to the PSISs. So for bony, then you would do lumbar soft palpation. You would start at the paraspinal muscles, and you would just start palpating them as a unit. So you would say the spinalis, the longissimus, and the iliocostalis. Then you would palpate the sciatic nerve. Then you would palpate glute maximus, glute medius. You would then do the hamstrings. You would do the biceps femoris. You would do the semitendinosus and the semimembranosus, and then the anterior abdominal muscles. After that, we start with orthopedic tests. You have Hoover's sign. Hoover's sign is when the patient lays down. The examiner inspects the patient and puts both his hands under his legs. Tells the patient to lift one leg, and then tells the patient to lift the other leg. The positive would be lack of counter pressure on the healthy side, indicating lack of organic basis for paralysis, malingering, or hysteria. But with organic hemiplegia, the patient will still exert downward pressure when attempting to raise paralyzed leg. Then you have the straight leg raiser, SLR test. You would have the patient lay flat again, supine. The examiner raises the patient's leg to 90 degrees or to the point of pain. The positive would be radiating pain and or dull posterior thigh pain, so in the back, indicating sciatic radiculopathy or tight hamstrings. The positive between 35 and 70 degrees, so about here, would be a possible discogenic sciatic radiculopathy. After that, you have Goldthwait sign. Patient lays flat on his back, supine. Doctor-patient places their fingers under the interspinous spaces of the patient's lower back. You would then have as the doctor, you would raise one of the patient's extended legs, so the leg would be fully extended. So you would raise it all the way up. Positive would be localized pain, low back pain, or radiating pain on the back of the leg, indicating a lumbosacral or sacroiliac pathology. If it's the pain occurs after the lumbar spinuses move, it's a possible lumbosacral problem. If the pain occurs before the lumbars move, it's a possible sacroiliac problem. Then you have Braggart sign. Braggart sign is very simple. It's just a straight leg raiser. You do it 5 degrees, and then you sharply or firmly dorsiflex the patient's foot. So you would do it 5 degrees, and then the patient's foot. Positive would be radiating pain in the posterior thigh, indicating sciatic radiculopathy. Sit down now. Then after that, you'd have buckling sign. Buckling sign, you'd have the patient lay flat. You once again perform a straight leg raise on the patient. Pain in the posterior thigh with sudden knee flexion or buckle indicates sciatic radiculopathy. Then you have bowstring sign. Bowstring sign, you'd have the patient lay flat as the doctor places the patient's leg up on their shoulder, and then you would apply pressure to the hamstrings and then move slowly up to the popliteal fossa. The positive would be pain in the lumbar region or radiculopathy, indicating sciatic nerve compression. It also helps rule out tight hamstrings. Then have Lasag's test. Lasag's test, The patient would be laying on his back. The hip and the leg are bent like 90 degrees, just like Koenig's. You slowly extend the knee to as close as you can to 90 degrees. The positive would be reproduction or of sciatic pain before 60 degrees. So it would be reproduction of pain, I guess you could do it this way, before 90 degrees. So right about here, indicating sciatica. Milgram's test. The patient lays flat on his back, and then you raise both the patient's legs 2 to 3 inches off the table, basically just like leg lifts, and you let go and see if the patient can hold for 30 seconds. Positive is the inability to perform the test and or low back pain, indicating weak abdominal muscles or a space-occupying lesion. You then have Valsalva's maneuver, which is the same thing as Valsalva's cervical. So you'd have the patient seated, and then you'd have the patient take a deep breath, and then bear down like they're having a bowel movement. Radiating pain from the site of lesion, usually positive in cervical or lumbar, indicates a space-occupying lesion, such as a disc pathology. The Bechterew test. The Bechterew test, you would have the patient kick one leg, extend one leg fully, extend the other leg fully, and extend both legs fully at the same time. Positive would be reproduction of radicular pain or inability to perform the correct test due to the tripod sign. Tripod sign would be if they kick both legs out, they'd have to lean back like this, indicating sciatic radiculopathy. So the 3 tests that all indicate sciatic radiculopathy all start with B, and they're Braggard's, Bechterew, and buckling sign. Neary's bowing sign. I would basically just ask the patient to bend forward at the waist like this. Pain accompanied by flexion of the knee on the affected side and body rotation away from the affected side, indicating positive with a variety of low back pathologies, meaning it happens a lot. Hamstring tension on the pelvis may trigger the response. Then you have the anterior innominate test. You would have the patient standing. I would ask the patient to advance one leg forward about 2 feet. Patient is then instructed to bend forward from the waist and touch the advanced foot with both hands. So both hands touch this foot. A positive would be the inability to bend the waist more than 45 degrees because of either radiating back pain along the sciatic nerve, either unilateral or bilateral, indicating sciatic neuralgia or radiculopathy, etc., possibly due to lumbar disc pathology, or the inability to bend the waist more than 45 degrees because of either low back pain, lumbar or pelvic region, indicating anterior rotational displacement of the ilium relative to the sacrum. You then have Lewin's standing test, where I would just tell the patient to bend forward slightly at the waist with knees flexed, so they would almost like skiing. As the doctor, you would first bring one knee into complete extension, and then the other knee into complete extension, and then both knees into complete extension. The positive would be radiating pain down the leg, causing the flexion of the patient's knee or knees, both of them, indicating gluteal or lumbosacral or sacroiliac pathologies. Then you have the heel walk, where you just literally ask the patient to walk on their heels. The positive would be the inability to perform the test, indicating an L4, L5 disc problem, which would be an L5 nerve root. And then you have the toe walk, which is the same thing as the heel walk. You just have the patient walk around their toes. And the positive would be the inability to perform the test, indicating an L5, S1 disc problem with an S1 nerve root.